Welcome to the launch event of Cheshire and Merseyside AHP faculty's Practice Educator Toolkit. Firstly, we'll start with some introductions. So I'm Charlotte Golson, I'm the Project Manager for the Clinical Placement Expansion Programme, and then I'll let Nisha and Graham introduce themselves. So Nisha.
Hi everyone, I'm Nisha. I am Cheshire and Merseyside AHP Faculty Lead. Graham.
Hi everyone, I'm Graham and I'm Cheshire and Merseyside AHP Faculty Project Support Coordinator.
Okay, so today we'll start with a bit of a background on the Clinical Placement Expansion Programme. Then we'll talk about the why and the how we've developed our toolkit and what the toolkit contains. And then we'll give you a little sneak peek of one of our videos. Then we'll be talking about the next steps now that we've launched our toolkit today, and part of this will involve our request for toolkit champions and what this role we anticipate it will involve. So a bit of a timeline for the Clinical Placement Expansion Programme. So in July 2020, Health Education England asked for bids nationally across nursing, midwifery and allied health professionals for the placement expansion projects. In September 2020, £15 million was awarded nationally to several bids across the country. In October 2020, St Helens and Knowsley Teaching Hospitals, as the host organisation for Cheshire and Merseyside AHP faculty, receives the funds for our successful bid, which was £200,000. Then between October and November, a recruitment process happened to recruit the project team, and the project team started in post in November 2020. Between November and June, we have been developing our toolkit, which obviously we're launching today. In June as well, we are collecting data ready to be submitted to Health Education England to prove that we have successfully achieved the aims of the project. Between June and August, we'll be closing down the project and handing over what we've created to those that are going to be using it before we finish in post in August. So our goal for the Clinical Placement Expansion Programme was to provide 100 new sustainable placements across 13 organisations that were involved in our project and across 10 different allied health professionals. The 100 placements, it was really important that they were sustainable placements and they weren't just one-off placements or COVID recovery placements. They need to be offered year on year. And on this slide, you can see the 13 organisations who were involved in our project. These are the organisations where our expanded placement numbers have come from. And then these are the 10 allied health professional groups that the numbers have come from, what we've aimed to cover through this toolkit. So when we started in post, we needed to figure out what the current situation was with placements and why there was a particular problem with them. And we identified three main issues. The first one being that there was no true known capacity among placement providers. So placement providers weren't able to say what the maximum number of students they could have was, or what was fair or what they should have. So for some areas, this meant that they had never had students or hadn't had students in a number of years. Or for example, if a placement area had had 3 students traditionally, they were always accepting 3 students, no matter if staffing levels had changed, they might have more educators in the team now, they were still just taking those 3 students. Generally as well, there was a one-to-one student to educator model. So what I mean by that is one student would go with one educator during one placement. There were some allied health professional groups that are doing this slightly differently already and have already moved over to 2-to-1 or more models, but generally that has been the case. And then the final point was students were needing to be on site at all time for their placement activities to count towards their placement hours. So what we needed to do was to bring placements into the 21st century, and we wanted to empower our clinicians who are providing these placements to help us take them there. So we wanted to incorporate peer-supported placements. So what I mean by this is having 2 or more students on placement at any one time so that they can support each other and learn from each other. We wanted to use multi-professional supervision models, so a student not always having to be with their own profession. They could be, for example, a physio student being supervised by an occupational therapist. We wanted to think about non-clinical placements such as leadership or project-based placements, looking into virtual aspects of placements or remote placements. So this could be entirely remote or virtual placements, but more often than not, it would be a face-to-face placement that had some remote or virtual aspects to it. And then we wanted to move towards the 2 students to 1 educator model. So to do this, we decided to develop our toolkit, and the purpose for our toolkit was that it would be used by clinical educators or clinical tutors for 2 reasons: to increase capacity, so to increase the number of students that they had on placement, so either increase over a year or increase the number of students they had at any one time on placement, and then to enhance the quality of the placements that they were providing, so to ensure they were in line with best current practice and guidelines. So thinking of the principles of our toolkit, it was really important that it was accessible to all. So with several different organisations involved in our project, it needed to be stored in a central location, both for ease of sharing and access. And to do this, it was preferable for it to be a digital solution. It needed to cater to allied health professionals. So we may have used strategies from other professions such as nursing or midwifery in our toolkit, but the focus needed to be on allied health professionals. It needed to be adaptable. So as new developments arise, such as new different placement types, we needed to be able to quickly and easily place them into our toolkit and make changes as necessary. It needed to house a variety of different strategies. So we all know that different allied health professional groups and even different teams can work completely differently. So we needed educators to be able to go into the toolkit, have a look around and see what would work specifically for their team and then choose that strategy. So we were giving them different options so that they had the choice for which was most suitable for their team. And then finally, we wanted it to be created by educators for educators. So educators are going to be the people who are going to be using these strategies and providing these placements. So they were probably the best people that are aware of the current issues when trying to increase the number of students on placement. So they were the best people to work with us to solve those issues by producing this toolkit. So now I'm just going to hand over to Nisha, who's going to talk to you about the how of and the why of why we created this toolkit.
So the initial exercise we conducted was a scoping exercise, which took us on a bit of a treasure hunt, really looking for what is already out there, because we were very careful that we do not want to duplicate resources that have already been produced either regionally or nationally. We spoke to other parallel programs in the region, for example, the Enabling Effective Learning Environment projects in Cheshire and Merseyside. We engaged with all the universities who we would be collaborating with for all the professions that were taught in these universities to understand what they thought might work and what is already out there. We also organized drop-in sessions with our educators and our PEF teams from all these organizations, again, to tell us what they have already used, what's worked, and what they thought might be good to have in the toolkit. While we were doing this, we also were scoping for where we could hold our toolkit so it would be hosted and be accessible to everyone. So that's the kind of treasure hunt we went on to kind of get to our final destination. Next slide, please. We finally decided, based on that scoping exercise, that there would be 3 themes around which our tools would be based. The first one was the tried and tested strategies, so things that have already been tried and have worked in other professions. Could we learn from those and incorporate it into our professions as appropriate? For example, using weekend and shift models. We know that our nursing and midwifery colleagues get the learners to follow their supervisors on their weekends and shifts. Were we using these models consistently in the AHP world? The second theme was looking at, could we move with the times? So COVID has obviously pushed us into the digital age much sooner and faster than where we were pre-COVID. So could we make use of technology to enable placements and increasing capacity? And then the third theme was looking at fresh resources. So what we found was there were some resources out there that AHPs could use, but there generally seemed to be a lack of AHP targeted resources. So we thought we can produce some as part of the toolkit, and that's where the videos came in, which we'll tell you in more detail in a bit. As we completed our scoping exercise and came to these conclusions, we also came across the HEE Learning Hub, and it was purely by chance. The Learning Hub then became the host site for our toolkit. And again, I'll explain to you in a bit more detail in the next few slides. The next step for us was to go into our project management mode, really, from the faculty. We sent a call out into our Cheshire and Mersey organizations asking for educators, practice education facilitators, and our university partners to form these work streams, which would be forming the toolkit. We had 2 work streams that were tripartite in nature, consisting not just of educators and so providers rather, and the universities, but also learners as well. And there were 2 work streams, one which looked at strategies and tools that would go in the toolkit, and the other solely looked at developing these videos that were the fresh resources going into our toolkit. Next slide, please. Finally, the 2 work streams together came up with a list of strategies and tools that they then built upon. This diagram here summarizes all the tools that are contained in the toolkit after the work streams ended their work. What we hope is, as this flower blooms further, we can add more petals to it. So, for example, we haven't really delved into the world of research placements yet. So could there be a chance that in the future, as our toolkit champions develop the toolkit further, could there be a chance that we add that as another tool in this toolkit? So next slide, I'll just explain to you very briefly about each of these tools, but then it'll be very much about yourselves deep diving into the tools. So leadership placements, this is where students are placed with an educator who's in a leadership role. So in a clinical lead or a team lead role or operational or strategic lead. These placements could be wholly non-clinical or could be hybrid placements where the learner does half a week as a face-to-face clinical placement and then the other half in this non-clinical area. The second one is the whole team approach, so ways in which the whole team can be used by an educator to facilitate and support the student placement. So this includes utilizing our support workers, utilizing our newly qualified staff, and others who don't maybe consider themselves as educators, and how they can support that learner. The third one is example timetables. So these were timetables that were created by our clinicians in the work streams to show how they have supported or would support more than one student on placement at a time. So we have examples of timetables from various professions in our toolkit and a blank timetable template as well. So if a clinician is thinking about taking more students on, they can pick up one of these for inspiration, adapt them, tweak them the way they want it. They also give ideas of various activities that learners can engage in if they were off-site or non-face-to-face. The next one is hub and spoke model. So this is not new, it's been around for a while. And this is where a student is allocated to a main placement area where they complete most of their placement and then they spoke out into other related areas for shorter periods of time during the same placement allocation. The next one we've gone into is the peer learning aspect. So students are given the opportunity to work towards their goals together with other learners on placement. So this could be learners from a different year who are on placement at that same time, or it could be interprofessional learning as well. Pre-prepared induction information. So completing induction-based activities prior to the student's placement starts, so to ensure a more efficient induction process and sort of setting the ground rules from the outset, really. The next one I've briefly mentioned before, which is around shift patterns and weekend working, where learners participate in these rotas as part of their placement. And the last one there is use of laptops. So this is our first foray into the text placement area. So text being technology enabled care services, and how can we use technology to facilitate a placement and increasing capacity. So this section contains all the strategies that the that the work streams have come up with as to how you can use laptops. Next slide, please. So the HEE Learning Hub, so just want to kind of briefly tell you about it so you can access it. So HEE Learning Hub is available to all health and social care staff and students. You just need to get yourself a username and password using your work email ID. It's automated, so when you register, it sends you an email for verification, and then you're in. What we've done is created a Cheshire and Merseyside AHP faculty catalogue. And in that catalogue, we have put in our toolkit and our tools in 2 documents. So once you've got access to the Learning Hub, you can search for the catalogue and hence our tools. The links to those are in this slide as well. The toolkit and the tools can then be viewed and downloaded onto your own laptop or device for storing and using and tweaking as you please. Next slide, please. So what we've done is we've created a quick guide as a separate video, a shorter video on YouTube, which contains all the details that tell you how to access the Learning Hub and then how to then locate our faculty catalogue, and then the introduction of the toolkit. It tells you how to use the toolkit as well, and the most sort of standout parts of the toolkit itself. Next slide, please. Okay, so before we go into more detail around some of the resources, what we wanted to do is show you a promo of one of the videos resources that we've made as part of the toolkit. So what we'll do is we'll show you this promo first, and then I'll talk you through briefly around what to expect from the videos. So can we have the video, please?
There are 3 learning outcomes in this case study. Increase awareness of the Making Every Contact Count or MEC approach. Employ appropriate communication and questioning skills when using a MEC approach during AHP treatment sessions. Improve awareness of local smoking cessation services to signpost patients to.
How is your diabetes control? Very well, I think. We have 4 months a day.
Okay, that's fine. We'll pause the video there. And we'll just go back to our slides, but I'll explain to you a little bit more about the videos. So that was a really short promo for the videos and what to expect. But each video will have its own learning outcomes. And following that, it will also have a section of wraparound learning. And what we mean by wraparound learning is a set of questions that students can go away and answer. They don't have to be on site, face to face to be doing these activities. And the whole idea behind the videos is to give a resource that enables students to continue learning even if they were not on site. So these can be used in combination with face-to-face learning activities to enable more students to be present on placement. There's 2 types of videos that we have made. One are multi-professional case studies. This is where groups of clinicians came together to think of a scenario that would be most effective, and then look at their learning outcomes, writing a script, and then getting real clinicians to reprise their roles on the videos. We hired a media company and looked for actors to play the service users. So that's one type of video. The second type is where we have actually shot live patient consultations, mainly in outpatient settings for a variety of professions. Both the videos, though, we've tried to stress on not just clinical skills, but the softer skills that clinicians at AHPs use all the time in their consultations. So looking at communicating in tricky situations, or looking at shared decision making, mental capacity assessments, and so on and so forth. So at the minute, we've got a couple of videos on there, but we hope over the next 2 months, as they're in the editing stage, we'll have a steady stream of videos coming out on the toolkit. So that really is a synopsis of the toolkit itself. As we said, we've got the quick guide on YouTube and a separate link. So please look at that for more detail of the toolkit and how to access it, etc. Now, what we do love is feedback. So there's a couple of ways you can provide us feedback once you've looked at the toolkit. There is community feedback like you would on any social media with a star rating under each resource. But there's also links to our SurveyMonkey on the description of the introduction to the toolkit and the actual tools. If you just click on the link, there's a set of questions. If you can answer that and leave some feedback, that would be fantastic as well. So with that, what we want to stress is the toolkit is live. It's there for you to see. This is just a taster really. And now it's for you to go and explore that toolkit and decide which tools work for you. So it's a very pick and mix approach that we've provided you a toolkit. You just pick what suits you out of that. Next slide, please. In terms of our next steps, we are still here. So when I say we, it's the faculty project team. We are still here to support our educators who are in the process of thinking of different strategies of how to support more students. We are also looking at recruiting some toolkit champions, and I'll tell you a bit more about their role in a second. And we hope that the first meeting for the toolkit champions, we'll be able to support them to take this work forward. So the Toolkit Champions, we've asked for volunteers from all of our organizations, so not just the 13 who were involved in CPEP, but all of them in Cheshire and Merseyside, because this toolkit is accessible to all of you. It's not been restricted access. So we've asked for volunteers who their main role will be to promote the toolkit within their own organizations internally. Because if the toolkit doesn't reach where it's supposed to reach, all this work, will not be used and utilized really. So the toolkit champions will be doing some promotion work. They will also be looking at further development of the toolkit. So where we've mentioned feedback, they might look at feedback to see which part of the toolkit needs development further. Our first meeting for the Toolkit Champions is on the 1st of July, and we've requested that we have all the names back by the 23rd of June, if possible. The project team will be here till they are in post till August to support the working party of the Toolkit Champions. So if you think you're interested in being a champion, please get in touch with us or your lead AHP. It's a fantastic opportunity to develop some of your leadership skills and your QI skills, to help you as well in your careers. Next slide, please. So these are just some save the dates. As I said, the 1st of July is the first meeting for our Toolkit Champions. We are also hoping to get together a webinar in collaboration with Greater Manchester CPIP program, purely on leadership placements. So you can look out for that invite soon. And lastly, we are planning a date for for a bit of celebration as we have achieved our target for CPEP. So again, watch out for those invites coming your way. Next slide, please. So that slide really concludes this presentation. It's got all our contact details if you want to get in touch with the project team. It also has our Twitter handle. So if you are on Twitter, please do follow as we post out information on our webinars, etc. regularly on our Twitter handle as well. So with that, the project team, on behalf of the project team, we just want to say a massive thank you for listening to us. But yeah, get in touch. Thank you. Bye-bye.